Welcome to the podcast that I don't really have a name for at this point. When we sat down and kind of wanted to do this and put this together, it was more or less for the listeners to have an idea of what ABA therapy is, what some of the autism services are, as well as give you a bit of an introduction into my life as well as Amy's life and our children, Ashton and Tristan. Those that have seen the website have read some of the blogs. We're very transparent on our life because we like helping those around us and hope that some of our stories help a few people that read it, as well as those that just need an introduction into the life with children with autism. So what I'm going to do is I'm going to get started, give a little bit of background into Janelle Ginter and Amy Shout, and let them give us some introductions to themselves. Janelle is the interim director of the ABA Little Tots program at Autism Services, which Amy and I know a lot of because both of our sons have gone through partially through the ABA therapy program. So I'll let you start off, Janelle.
Sure. Thanks, Evan. So yeah, I'm a board certified behavior analyst in the ABA Little Tots program. I've been with Autism Services for 13 years, if not more, if you count my casual stuff and family programs. And yeah, I kind of got started there with their family programs, working throughout my university studies. At the time, I had no real, want or need to kind of stay. It was just, I was planning to kind of further my education, wanted to start teaching. And then once I started really working more family programs and getting more into it, I just fell in love with it and kind of switched what I wanted to do with my education and kind of jumped into working full time in the autism intervention program. And then kind of things just kept falling into place and we started the ABA Little Tots program. And then, 13 years later, I'm still here.
Amy.
Awesome. Thanks, Janelle. I'm Amy Shout. I am a mom of two boys with autism, Ashton, age 12, Tristan is age 10. Before I decided to be a full-time mom, I had an early childhood education degree and spent 5 years teaching as a resource teacher, an elementary teacher, and did some work in special programs as well. So I thought I would be very equipped to deal with two boys with autism, and it's really different when they're your own kids.
12 years later, has that changed?
Here we are. No, just a new challenge every day.
So I think what we'll start is, obviously some may not know what ABA therapy is. So Janelle, just give us a broad definition or explanation, I guess, of ABA therapy and what you've seen in your years of being part of, the ABA program or a structured program such as that.
Sure. So applied behavior analysis is essentially looking at how the environment affects behavior. So we kind of look at what happens before a behavior, what happens after the behavior, and then we kind of look at manipulating some of those things. So adding in supports when we can, and then also kind of switching out how we're reacting to certain behaviors to kind of help an individual learn and to kind of get rid of those challenging behaviors that are occurring. We do use a lot of positive reinforcement when teaching. That's kind of like what we kind of go to. We break things down into little steps so that the learner is successful and nothing's really too frustrating or too challenging for them. So kind of really trying to celebrate those like little successes with them and then building up to larger skills. A lot of ABA too is kind of based on the relationship that they have with their therapist. So we do a lot of rapport building, and that's kind of the most important part. We're not going to have effective teaching if you don't have those good, solid relationships. So as you guys have kind of seen in the program too, you might go through lots of therapists until you find the right therapist, right fit for your kiddo, but you're always just trying to build that relationship. One thing I tell my therapists that the play should be more fun when they're involved with the play versus if the child's just doing it on their own. So that's kind of always the goal, is to make it so that the child wants you to be playing with them. And that's the only way that you're really going to be able to teach. Kind of in the more recent years, I'd say in the past 2 to 3 years, ABA kind of has shifted to more like a assent-based services, more child-centered, more person-centered. So that's kind of been nice. So it's kind of more of a compassionate approach, I guess, than what it used to be. So it's kind of been a shift in the field and kind of what we're going for, more following the child's lead. So that's kind of, I guess.
Yeah. Can you talk a little bit about the success rate of ABA therapy and the response rate for kids? Like, would you say you get maybe 90% of kids have a positive response, or is it going to work on all kids, I guess?
So I would say I haven't really encountered a child that hasn't really been, I don't know, I guess it depends how you define successful. I think all kids can kind of grow and learn in ABA. It kind of just depends where they're at, and also like the commitment level too. Like if you're gonna, our program is 20 hours, 25 hours a week. So if the parents are putting in lots of work like outside of the program too, you're going to see more of that success rate. Whereas if they're like missing sessions or they're not doing like applying those principles outside, then you might not get it as much of a success rate. But I would say that everybody definitely benefits from a program such as ours, especially when it is kind of that intensive nature, that 20 to 25 hours a week. But I don't know what the numbers would be.
No, we noticed that difference, like, because when our first experience with ABA was the Autism Intervention Program, and our oldest was involved in that right after we had our intake meeting with Autism Services, we thought, okay, let's get involved with AIP or Autism Intervention and see if they can help us either curb some of these behaviors or teach new skills, like especially around communication that we were really lacking. And we were finding like the lack of skills, communication most notably, was what was contributing to the behaviors that we were seeing. So we're like, what are the functions of this behavior and why are we getting it? And not being able to understand or convey what you're trying to tell us, it was a big part of like that communication breakdown piece. So we thought, let's get AIP and see what happens. And so with that, you got like a block therapy where you had a structured set, maybe a 6-week block, and somebody would either come to your home or you go to the office once or twice a week for a number of weeks until your session was over. And then you waited again on the list because there is a ton of need and only so much services, right? And so we found that if we continued the work that was happening with the therapist, we continued to at least maintain a skill until our next block. But if there was something that we didn't, like we just picked like, hey, we're not able to run all of these 5 goals. What's the most important? Well, maybe we could run 2 of them. So let's just continue to work on like that communication piece and this one behavior maybe that we want to extinguish for sure. And those were the things that we continued to progress with. And then the other ones, if you don't stay current and you don't at least do enough to maintain them, it's like you're starting all over again by the time you get back to the top of the wait list. So I find like ABA is really effective when you do it consistently. But it's not just like do this and it fixes your problem and you're good to go. Like it is like a lifelong process that always needs to be revisited. But if there was one tool that I am so happy to have in my box of what do I do now, it is ABA therapy training because it works.
And for any of those that have read the blogs, you now see why I get to write the blogs and not Amy, because she knows a lot more than I do about this. But a lot of the ABA stuff, and I've said this out loud, and I've said it in blogs before. We accredit it to probably saving. I mean, and this might be a stretch, but saving our kids' lives, because
it's not a stretch at all. Like
whether it was feeding therapy,
that's what happened.
So for us in the story, and if you read the blogs, I mean, our 2 kids, the professionals literally told us that they probably needed to be on feeding tubes because they weren't getting the dietary restraints they needed. And we chose a different route, and not saying that was the right choice or the wrong choice, but for us, ABA therapy was the solution that got them to eat. And today, as Amy said, it's a lifelong thing. Every meal involves ABA. Everything we do in life involves ABA, because the positive reinforcement, it's the way we function as a family, and it did save our kids' lives.
Well, and I would say since the winter of 2017, when we started ABA therapy for feeding with both of our children, we have been running that every meal, every day since 2017. And now we have some like nutritional choices. Not that they have to just live on clean whole foods all the time, every meal, but they need enough that I can at least say to the doctor, hey, if our issue is nutritional, I will be shocked. Or when I talk to a dietitian, I have actual information to say like, this is our food journal, and we are meeting like this much fiber, this much vegetables, this much fruit, this X number of protein, and whatever. So that is just another thing that we can rule out now when we're trying to problem solve with the kids. But I would also say is that the more we do it, the more routine it just becomes. And it's no longer a demand. It's just the way they eat now. Like, it's not stressful to them. And then if something does happen and there is, like, let's say there's a family gathering, like it's Christmas or a holiday event like that, and there's just like a free for all food spread out, hey, they might try something new because of all the feeding therapy that we've been going into. And then we just encourage that to try new foods, because our biggest problem was limiting what what they would accept dietary was so limited that they weren't getting nutritional requirements. So then we were like, if you pick up a new food of any kind, we're going to praise that, we're going to reinforce that. And then if you kind of get a little carried away on the cookies that are out, then we can curb that or stop that by putting out a whole food nutritious target, like how about some apples and cheese with those cookies or something like that, so that we're not just living on sugar and junk, but we're also getting what we like along with what we need. And then so that I found it slows them down. It reminds them of their real hunger cues. If they're not really hungry, they walk away. And if they are really hungry, they'll come and have a well-rounded snack now. So it's awesome, because once we dug through the trenches with the therapists and we got established a routine and established like how this would look and what are our reasonable goals, and we don't want to stretch them further than their capacity at any given time, because that's just not fair. But once we got to the point where we could run that at every meal, all of a sudden it's just the way we eat now. And it's not such a big commitment on everybody's part. It's just routine. So
two questions. First question, Janelle. What other areas other than feeding? Because obviously for us, feeding was a big one, as well as there's a few others we'll touch on. But for you, where are the biggest areas you've seen ABA, and with some of the kids that have gone through the program, have you seen the biggest leaps and bounds, I guess?
Yeah. So I think communication, like that's definitely our most important area that we always target. Just making sure that we give them a voice, whether that be an AAC device, gestures, or like speaking vocally, kind of anything to get their needs met, right? Because that's the most important thing, is to make sure that they can be independent. And that's kind of the whole goal of ABA, is giving that independency and letting them, use their voices. So kind of as soon as you can get that communication piece too, that's where you see a lot of that decrease in challenging behaviors and giving them other ways to get their needs met versus like engaging in that challenging behavior. Essentially though, any skill we can teach kind of using ABA. So there's been like so many things that a parent's like, I know this is little and you might not be able to do this, but like, is there a way
swallowing medication is one.
We can do anything. So as long as it's like significant to that child. So that's kind of what we always look at too, is making sure, okay, is this a goal for you as a parent because it might be an annoyance of your child, or is this a goal that's going to help out your child? So it's always like looking at that and, okay, if this is going to be significant in their lives and help them, kind of access reinforcement more by themselves, or be able to be more independent, or to be generally just more happy, then it's like a goal that we can definitely work on.
So I got one question for you, Amy, and obviously part of it's because I know the story and we've told the story a million times, but I also don't want the listeners to think that this was something that just happens overnight. So you mentioned the medication. So give us a bit of the story on the first time Tristan took a multivitamin for us.
Well, we sat at the table for 4 hours that day waiting, and every single therapist stayed over their lunch break, and every single therapist stayed beyond dismissal time, because we were all committed to, if this doesn't happen today and we let him off the hook, he learns that I can wait this out and I can get away with it. So we all had to, take turns and be patient. And finally, we got there where we just had a little sprinkle of vitamin in him, and that was our win for the day. And then the next day we went in and we waited 2 hours and not 4. And then the week after that, it was half an hour. And then, by the end of the month, it was chewing half a vitamin and then working on some foods. So it was gradual, but it was also very intensive. And it was very consistent. And I think that is what makes ABA therapy so successful, is that it is more intensive than a lot of the other therapy choices that we've tried, where it's either just play based or something just occurring organically. Like, yes, we do follow the child's lead. Oh, hey, he's really interested in this musical toy today, or he really likes it when I chase him around the room. Okay, well, how can we use that to engage him and perform the behaviors and not perform the behaviors that maybe we are trying to extinguish, and then elicit the behaviors that we want as a response? So maybe we're hoping for eye contact, and he looks at us and we're like, hey, you get the music toy, thanks for looking at us, and so I just feel like if you stick to the plan and make it intensive, it's going to work. And basically, our biggest struggle is after they're kind of discharged, I guess, from therapy, it's up to the family. And then it's up to the family and the school together. And sometimes those professionals don't have the same kind of background or training or experience to be able to continue with the work that you started. And so goals change and therapies change and approaches change. And I really feel like, wow, wouldn't it be so beneficial if there was an ABA therapist in every special ed room or part of every special ed program that at least could go and train other people to spread it out further than just you have to be admitted into this program to be able to reap the benefits or learn this way of teaching and doing.
Well, and the one thing I don't want to skim over, because you did say it, was you can't let them off the hook. And that was, I think that's part of why, it's not a struggle, but why it's a lifetime thing, is that if you're going to start ABA, or even just, even at a one feeding, if they don't take a bite and you let them off the hook, you've just gone against the whole therapy that you started. So it's no different than, let's say you have a typical kid and you threaten them that I'm going to take away your Game Boy if you don't do something. You now have to follow through on that. So what we found was, even if they're not, let's say you bring out strawberries and they don't want them, you still have to go through that first strawberry, because they can't know that they can just get away with saying no. So I think that was part of it too, was that when you dedicate it to, and you're going to follow this, you have to go 100%. There is no halfway.
Well,
if you go halfway, it fails.
Even things like oral hygiene, nail clipping, hair brushing, things like that our kids are ultra sensitive to. It probably took me, honestly, 2 to 3 years for my youngest to let me floss his teeth. And so it would just start, I'd show him the floss, and he would touch it to his mouth, and I'd be like, hey, great, we're done. Totally just accept that. And then we would just keep doing that at the level that he was able. And then maybe the next time it was, oh, he really wants to play iPad. Okay. And I would get that floss between 2 little teeth on the bottom and be like, hey, that's it, we're done flossing for today. And then give him the iPad, and then just keep doing that and building up and building up and building up. And eventually you're through his whole mouth, and then he gets his reinforcer after that, But in the beginning, he didn't even want to open his mouth for it. So our first goal in the beginning was, just touch this floss to your mouth first in the first place, or watch me do it to myself first, so that what's about to happen. Because I feel like a lot of problems are, there's no modeling, and then they're not able to even to attend to the modeling. So sometimes I had to reinforce them attending to the model just to even start, so that they knew what I was working on. Because a lot of the times they were just like, I don't know why you're coming at me with this giant toothbrush, and it's scaring the heck out of me when I just say, watch, and then I open my mouth and I brush, and then I'll say, okay, your turn. And if they just even licked it in the beginning, I was like, hey, right on, and we would do it. And now we sit and get our whole mouth done every morning all the time. But there are some things that are just, no, this is happening, and there is no compromise on. And hygiene is one of those things.
Yeah. That's the thing, like you said, all of the expectations are reasonable, right, for the child. So you're always going to start, and we call it shaping, but essentially what you said, you're starting with the smallest thing that that they can do, and then you're going to keep building up. And really, yeah, having those, knowing when things are really important, like you said, the feeding, that was a thing that it was we need this kid to eat, or he's going to have a feeding tube type thing. And kind of knowing like, yeah, how hard to push with those things, and then knowing when something might not be important. So we're definitely going to do things differently when it's a skill like that you're like, you need this to like be
Well,
safe.
and like knowing what the family unit can tolerate too, like there's lots of people that have typical children and children on the spectrum. And it's like, well, maybe they can't balance all that. Whereas in our household, everybody is on the spectrum, like both our children are. So it's just kind of like, this is how we do things now, and this is how we work towards goals. Can you maybe speak to like short term goals or successes that lead to something longer term? Because I feel like people are expecting for these grand changes overnight, and sometimes it's like we just need to start with some short-term goal setting and be happy with the pace. Like as long as there's progress, does it really matter how long it takes?
Yeah, no, exactly. As long as we're always just seeing progress, that's kind of the goal. So when I look at programs, we take data on everything, as you know. So we're always looking back and, okay, they're making progress. Great. We can keep going ahead and doing it this way. And then if they're not making progress, it's like, okay, what do we need to change? Do we need to add another small like step even in between this? So yeah, we kind of break down. I can use a feeding example since you guys are well versed with that. But kind of, yeah, how we start with feeding. So if a kid's not even going to touch a food or like look at a food, it might first start with them just like accepting that food on a plate in front of them. And then you're going to build up to, yeah, they'll touch the food, and then it might be picking up the food and then putting the food to their mouth, and then like actually like tasting, and like just slowly building up. And as long as, yeah, we're seeing kind of progress with that, it's just huge. And I think you guys know too that we just celebrate any little small progress is huge.
Because it's not like, small. Like
no, and that's the most rewarding part I think about my job, is being able to just celebrate all those little like things that other people on the outside world might be like, well, that was nothing. Like they picked up a piece of food, but you're like, what? They picked.
We've been waiting for months. Yeah,
it's
a breakthrough.
A party for that. Yeah, so. Yeah, I think that's like the most like cool thing about ABA too, is you can just celebrate like those tiny little teaching steps, and then yeah, you're building up to like that bigger thing of eventually they're eating that food, they're taking those bites. Kind of work like with communication too. Like I know recently, one of the clients I was working with, like had no joint attention or like no communication ways at all, and it was like, to start with, it was just like this client handing an object to the therapist. Like that was their way to communicate. If they can like pick up an object and just give it to the person, like, wow, that's huge. And then we slowly were able to build up to like eye contact, and then reaching the items towards, and now working on like using a AAC device to get them to communicate. So just breaking it down so like small, and to give them that success, and to like let them see like, okay, I can do this and be successful, and I'm going to get reinforced for this, and things are going to be way easier for me if I can communicate.
Well, and I think part of the biggest thing too for us is once it did get instilled, and as we said, we talked, this is a year's thing, this is not a day's thing or an hour's thing. Now it's to the point where if Tristan won't put his shoes on, for example, I literally can just reach over and pull the iPad back, and he'll put his shoes on, and I hand the iPad back. Like it's gotten to the point where we've instilled it so much into the life that
we can generalize it.
Yeah. So, and then that was big. I mean, especially, and I'm speaking from myself, because obviously Amy knows this stuff better than I do. From a parent who had no expertise with autism before, and no knowledge of any of this, including the ABA, until we were part of it, it makes it doable. And I think part of why maybe parents fail in the past is that it's just not doable. And for us, we're still at certain things. I mean, potty training and stuff like that it's hard for us because we don't have enough staff during the week or during the day to allow us to just consistently hit it. But that's the goal. And I mean, for us, it was take one step at a time. So it was feeding, and then it was medications, and then
communication,
and the teeth, everything like that.
Extinguishing public masturbation. Like, come on, there's a list a mile long. And ABA has helped them all. Sorry to cut you off, Evan, but I just wanted to ask Janelle a question too about, we were talking about the relationship between a therapist and a client. And I know that in the beginning phases, when our kids first were immersed in like AIP, where the intervention program, or the ABA, Little Tots program, they spent some time pairing with a therapist before demands were placed on them. Can you talk about that a little bit?
Yeah, yeah. So I would say that's like the most important part of ABA is pairing. So we're always consistently, so like you said, usually we'll spend like several sessions pairing with a child before putting demand just to show them like, hey, you're fun. I want to be with you. You're somebody I want to be listening to, somebody I want in a room with me. You're not going to be able to teach them until that they want to be with you. Because as soon as you start putting demands on them, and if you're not fun, they're just going to be like, oh, why would I want to listen to you? Or I'm going to start escaping you because you
This is
only
work.
take away joys from me, or you only, yeah, put work on me. Like, this isn't fun. So we're constantly just always trying to pair ourselves with the child, with the reinforcer. So even if it's a child that might like stimming more, so even if they're like a kid that likes just running back and forth in a room, like we're going to run with them and we're going to add something into that. Like, oh, maybe we'll blow bubbles while they're running, to like always be adding something fun and engaging in for them, because they're spending a lot of time with us. If they don't like us or want to be with us, like that's not going to make it fun for them. It's not going to make our job easier. So yeah, just that rapport building, and always like building. So lots of people think like, well, I paired with them my 2 sessions, like I'm good. We have it, but it's like, no, it's always ongoing, always like
Yeah.
knowing when to pull back maybe from programs when you're like, okay, we like had a session with a lot of challenging behavior, let's pull back the programs and let's just work on like repairing and establishing myself as a reinforcer essentially.
I like the way you said that. Sorry to interrupt you, Evan, but I just found that with therapy, it's not just a linear progression of up, up, up all the time. Like it's very much like up and down, always at the end progressing, but it's never just a straight shot of success. Like there are setbacks all the time. Is that pretty normal for
Yeah,
ABA?
yeah, 100%. Yeah, there's always like little things that we're like, oh, this came up. Okay, like how do we work our way through this? How do we get through this? Okay, let's pull back some of these programs and focus on this. So yeah, there's always little things, or yeah, things might come up that you're like, oh, they were doing so good on this, and now like what's going on, and kind of assessing like, is there something in the environment we need to change? Are we doing something differently? Maybe it's something medically that's going on. There's so many like little aspects kind of to look at and to
Or
search
like, did
for
you
that.
sleep through the night? Did you eat breakfast? Did you work on this at home when there was Christmas break for 2 weeks? And like, does that set us back a little bit now that you're back? And kind of like meeting them where they're at a lot
Yeah,
of, hey, and
exactly. Yeah.
guessing that where are they at today in
Yeah.
this moment?
Yeah.
Like, because it's not going to be the same every day, unfortunately,
Yeah.
hey?
Yeah.
Well, and
Exactly.
I can remember the pairing with the guys throwing the kids around because both our kids love to be lifted, love
Yeah.
to be thrown, love to be
Yeah.
tickled, and it's funny, but back then the guys were the couple that were strong enough to do it, so they always paired very well with the kids, and
Yeah.
that made the therapies better. So I
Or anybody who could jump on our trampoline. And then, we were working on iPad requesting or handing the picture of jump or hitting that jump button. And then it was like that immediate reaction. Maybe you can talk a little bit about that too, as in like it should be immediate, right? Like
Yeah. Yeah.
the
Exactly. Yeah. So to make reinforcement, I guess, work is it should be, yeah, like you said, immediate right after. A lot of times people will, with neurotypical kids, you can like reinforce them later, right? They do well at school, they come home, and you're like, oh yeah, good job. I heard you did good. But with a kid with autism, like they don't necessarily make that connection of like, if something happened an hour ago and you're like, oh, good job. Like you did awesome in this
they're
class an
just
hour
like,
ago.
where is this candy coming from? Why did I get it?
Following that behavior that you want to see with that like quick immediate reinforcement is super important. And then like slowly the whole goal is to be able to generalize that to just like that social praise. So that's why when we're giving like a tangible item, we're always adding that social praise too, because that's what they're going to get more in the natural environment, more when they're at school, is kind of that social. So we kind of want to teach them like, this is something that's good too, is like getting that high five, getting that good job, And some kids, it is going to be harder to get rid of that kind of tangible reinforcer. They might not have kind of that intrinsic motivation as much, but that's generally the goal, is to always kind of get to that point.
I feel like no kid ages out of ABA therapy. Like, it is an early childhood intervention strategy, yes, but as into my teenage years, when maybe that all that is available to us right now would be AIP, where or of a block therapy of some sort, or some kind of out of pocket private ABA, even though that's hard to come by and there's wait lists for that too. If there did exist some kind of therapy, ABA based, like either day program or summer program or something like that, would that be a program that could essentially apply to kids above age 5 or that age 11, where all those early childhood cutoffs seem to be around 5 or 11? But I'm finding like those kids that are like 11 to 18, 20 years old, where they're like too young for a day program, too old for the early childhood intervention. They're just kind of floating. Would ABA therapy be an option for kids in that age range?
Yeah, for sure. So, like you guys know, Saskatchewan is still very behind
Yeah.
in general with services, but especially when it comes to like, yeah, serving those like populations that are in like that age range. And you look at like Ontario, they have lots of like schools and stuff, or like in the States that are specifically like ABA schools. And for like kids, yeah, elementary age, high school age, there's lots of programs too that have like adult like programs for like work skills and life skills and using ABA. So yeah, definitely benefits kind of any learner. With like the early intervention, it kind of just helps kind of shift that trajectory of learning. So the earlier you start, the like higher their rates of learning are going to like keep growing, and they're kind of going to be like at that curve of learning of maybe like a more neurotypical child, how they learn. So the later you start, you're definitely still going to get benefits. You're still going to like learn everything. It just might be like a slower rate, and kind of depends too on the individual. Like everybody obviously learns differently too, but I think ABA can be kind of applied to any age group. It doesn't even need to be applied to the autistic population, kind of can be applied anywhere. There is lots, like it's funny when you hear about ABA, you kind of only hear about it like with autism, but it's actually like a whole, like there's so many different aspects of ABA. There's like ABA in like the workforce, ABA like with like drug addiction. There's just so many like different, I guess, forms of ABA that are used. But I think like the most known one is obviously with kiddos with autism.
Okay, so we're over the half hour part, and I'm getting lots of echo through Amy's program, so it's okay. I'm gonna cut it off. Yeah, I'm gonna cut it off here, but I do want one more question, Janelle, before I let you leave. If you could stand in front of new parents who are facing a diagnosis, what is the one thing you would tell them and want them to know moving forward?
Find that support system. Obviously, you're going to have a lot of challenges with a child with autism, and having like that good support system, whether it be family, whether it be the community, whether it be professionals, just having that support system that's going to help you when you're facing those challenges. But then also, like we were talking about earlier, going to help like celebrate those like little tiny things that are occurring that like the general population might not see as something huge for you, but just like being able to really celebrate that with you. And then finding the right professionals too. I think a lot of people are so desperate for help that they're kind of like, okay, we'll work with anybody. And even if they kind of start that therapy and you're like, I don't know, like, I don't know if this is the right person, they kind of stay because they're like, well, there's nothing else. But just making sure you have that professional that fits with you, with your child, trying to find somebody that is regulated too. There's a lot of people that will work with kids with autism, but might not be like regulated like under a board and stuff too. So that's kind of important, I'd say too, to try to find somebody that that they're making sure that they're following those ethical guidelines, working with kids, or staying up to date with their education on like what's working and what's kind of in the field. But yeah, just not being scared to walk away from people, I guess, if it's not working, finding your right people. And then, yeah, I think that's being able to advocate.
Yeah, I was good. That was what I was going to say. Just be ready to advocate on your child's behalf for everything and never stop, because you're their voice, you're their person, and advocating for your child will actually end up advocating for your whole family in the
Yep,
end.
exactly. Yeah, I think
Yeah.
as soon as you have a child with autism, you're just going to become an advocate, whether you want to or not. But
Yeah.
unfortunately, that's just a role that as parents, it's kind of, yeah, you have to take it on and you're kind of forced. And you'll kind of see as your child grows into different areas, like, okay, now I'm advocating for this. I was advocating for this, but now I need to start advocating for this. So, yeah, being willing to advocate and to maybe have to make some people angry. You're not always going to be able to please everybody, but knowing that what you need to do for your child is the most important, I'd say.
And I think my finish to this will probably just be, and again, this one's from my viewpoint. You guys have given the professional answers, but for me, it's don't be overwhelmed, because everything we talked about today, as we said, this is a lifetime journey. This is not going to happen, and no matter how much you want it to, this is not going to be an hour a day. This is going to be a lifetime. So just, I would say, start. That
Pick
would be the big
one
one for
thing
me.
and go with it. Just
Yeah,
pick one thing and go with it.
yeah,
Yeah.
because you will be overwhelmed.
And giving yourself that grace, right? Like
Oh,
parenting is hard enough with neurotypical kids. So I think once you have a kid that kind of needs more support too, just like, yeah, knowing that you're not going to do everything perfectly and that's fine as long as you're there for your kid in the end. That's all that really matters. And like you said, progress is going to be slow, and there might be times that you feel like nothing is working or nothing
yeah.
is moving forward. So just always like, yeah, taking that step back and be like, okay, what I'm doing now is good. I'm doing the best I can in that moment. And yeah, giving yourself that grace.
Okay. So I want to
Great.
thank
Thanks,
Janelle for
Janelle.
coming on. And I want to thank Amy for coming on. You're going to hear from us quite a bit more, I think, now that we've recorded one. We'll probably let the floodgates open, but I'm hoping you'll come back on, Janelle, when we set this up again, because obviously, as we said, ABA has been a big thing in our lives, and I think anybody listening should look into it if they haven't already, and definitely take a look at it. So again, for the podcast that's got no name, I really appreciate both you coming on and talking. That's all.